Welcome to Primary Care Today on ReachMD. I'm your host, Dr. Brian McDonough. And with me today is a very special guest. I'm talking with Steve Jacobs, and we're talking about medicine, how medicine works, and if Marcus Welby and the image of Marcus Welby has gone away. I really think this is a great topic. We have a primary care audience, and our guest is certainly well equipped to speak. Steve Jacobs has covered health policy for newspapers, magazines, healthcare organizations for many years, and he really has studied the healthcare situation pretty closely, and we've had lots of changes. So first of all, Stephen, welcome to the program.
Thank you so much, Brian. I'm really honored to be here.
You know, when you mentioned the topic, that was the first thing I saw when I saw the whole idea for those of us who grew up and watched Marcus Welby, and of course many more who have heard about Marcus Welby, quintessential family physician, did it all, worked out of his house. People didn't pay him with chickens, but they might as well have. He was doing home visits. Tell me a little bit about that image, where it's gone, and where you see, from your perspective, healthcare going.
Well, I think in a lot of ways, his spirit's still there, and there are still a lot of Marcus Welbys around. The thing that's kind of going away is his business model. The whole idea that you can be a solo practitioner and sort of face all of the headwinds that you have to face as a physician, with all the government regulation, the fact that you've got to have, you talk about you're a primary care physician. Right now, Marcus Welby had a partner, and they had one nurse/receptionist. And the average primary care physician today has to have 5 employees for every physician. So, Marcus Welby would have 10 employees now as opposed to the one to support those two physicians. So the big problem is back then, in Marcus Welby's day, insurance companies just paid whatever he billed. They billed for customary and reasonable services or fees, and that's not done today. Physicians are, their reimbursement is flat or declining, and their practice expenses are going up. So, I've talked to doctors, throughout my reporting, where they'll say stuff like, my income is maybe 30 to 50% lower than it was 5 years ago, but, that's okay. My kids are gone, and, I like my job, and so what? But I think very few of us, who are not doctors, would be okay with that. And I think we are going to pay a price for this long term, again, because we have more and more people getting insurance, but the access, I think, is going to become more and more difficult.
It's interesting you bring it up. I have a partner, actually, who talks about that all the time. He says, if I look at myself, I'm spending more time online, working on the computer, doing these charts, answering these questions, this, that, and the other thing. He feels his patients are getting less attention, and he really feels he's got all these other people he's carrying by the work he's doing that he doesn't know what they bring to the table. I mean, he's cynical, but he brings a lot of good points up.
No, I think that's absolutely true, and we've really gotten into ourselves into a muck as a result of this, and it's because of the sort of jerry-rigged way our healthcare system developed. When you compare our healthcare costs with all the other developed nations, we not only spend far more than they do, but we spend our government spends almost as much on healthcare as their governments do too. Then we just have a bunch of private spending lumped on top of that. So there's a lot of reasons for that. It's the fact that health insurance after World War II became tax deductible, and the fact that the patients are shielded by the cost because their insurers pay for most of it, although that's changing. So there's a lot of reasons for this, but we have a tremendous administrative burden in this country.
Do you see it getting better, or do you see it getting worse?
Well, I see it. I don't see it getting any better. I mean, at this point, I think, I do a lot of speaking, obviously, because I have books to sell. But, the biggest question I always get is, are we going to have a socialized healthcare system or universal healthcare? And I think, the answer I usually give is that likely by the middle of the next decade, we will have something that looks much like what the European nations have. And that's not a universal healthcare system. It's a dual healthcare system where, maybe 80 to 90% are treated by, a government employee or, government programs or government insurance. And then the others will have more of a private system. You go to England, which is arguably the most socialized system. They encourage that because for people who can afford it, They're not griping about the fact that they have these long waiting lines, and they can buy their way out of it. So I think we're going to end up more and more like the European systems, and in some respects they'll look more and more like us, because I think the private systems will become a little bit more muscular too. So that's where I think we're headed, and I'm not so sure that we're going to be looking that much better. I think the only glimmer of hope is the fact that insurance companies are now starting to pay for value rather than volume of care. And what needs to happen is that insurance companies need to pay doctors for doing things that keep people healthy. And right now, insurance companies don't do that. They pay, you, Dr. Brian, for doing stuff. And so, I think when that comes, we might have a little bit different healthcare system.
You do bring that up. That is a very interesting thing, although a lot of people will tell you at this point, quality is more or less keeping costs down. I mean, I think the things that they're pointing as quality metrics are getting people out of the hospital in 3 days instead of 5, or in my mind, I envision quality as you're able to reduce the incidence of this disease or that disease, or get them flu shots, or you know what I'm saying, kind of intervene, get them to make lifestyle changes, lose weight. Being involved in preventive medicine, I think, is where we need to get some sort of support in the system. And of course, there's a lot of people with a lot of opinions, but I think that's where your savings would be, thinking ahead 5, 10, 15 years as opposed to the savings that occur right now. By the way, if you're just tuning in, you're listening to Primary Care Today on ReachMD. I'm your host, Dr. Brian McDonough, and I am speaking with award-winning journalist Steve Jacob. And I want to talk a little bit about your book, So Long, Marcus Welby, MD, How Today's Healthcare is Suffocating Independent Physicians and How Some Changed to Thrive. What about those who changed to thrive? What are they doing? Well,
what a lot of them are doing are things like they're creating their own small practices. Some think of the classic one is a concierge physician, one of whom I do profile in there, and he charges his patients quite a bit. But there are other physicians that are doing something called micropractices, where they've gone completely the opposite, and they look a whole lot more like what Marcus Welby was, in that they strip away all of their overhead, and they see fewer patients, and they're able to kind of earn about the same amount of money they would if they had this big, practice with all these people they had employed, and we're seeing 30 patients a day. So technology has allowed physicians to do everything they need to do. They answer their own phone. They keep their own medical records. They, file all their prescriptions with electronically with pharmacies. So they've gone that route. There are a few that have gone who do, I don't want to get too deep in the weeds here, but they're doing independent practice models where doctors will sort of maintain independence, but they sort of get together in what's called an IPA, Independent Practice Association, and they are able to kind of negotiate as a group to with insurance companies. So different emerging models are popping up, I think, here. And I think that's, a lot of physicians, if they really work hard, can maintain that independence. But I think that's sort of a minority viewpoint that I think by and large, when you talk to young doctors who've never heard of Marcus Welby when they're coming out of medical school, they all expect to be employed, and you will never think about being their own independent physician.
One of the things I do, among other things, we teach young physicians, residency program, and what I see is a lot of them, and I can't say they're right or wrong, but what has really changed things as well is the work hours that residents have. Now, I'm not one of these people who says you should have a 15-hour workday day after day after day and do what we did when we were young, but the fact that they're kind of trained to go home at 4 o'clock, and in fact that you cannot have them stay longer if they've been on call because it goes against the rules, it really is starting to build a generation of those who believe it is hourly.
Absolutely, and it's going to take, and I think that's underappreciated, the fact that to replace a physician, and right now more than 4 out of 10 physicians are 55 years or older, and they are retiring, and most of those people worked 70, 80 hours a week because they have their own independent practices, and so they're retiring, and the young physicians are working more like 40 hours a week. They want life balance. Female physicians tend to work less because they have family obligations. And right now, about half of the medical school enrollment is women. So not that they're not going to make great doctors, but they have other priorities. So it's going to take two of the young doctors to replace one of the old ones. And the math is rather daunting when you sort all that out.
What about the concept of nurse practitioners? We have nurse practitioners who, again, work with us, and I see a great variability. Unfortunately, there's not as much consistency in the education. It's shorter, and there are some programs which are easier than the others, and there's some where they really get fantastic experience. How is that going, and have you delved into that issue and where it's impacting healthcare?
Yeah, right now, nurse practitioners and physician assistants can do about 80% of what primary care doctors can do. Arguably, there's some argument over whether they do it as well as physicians. Most of the research says that if they stay within that narrow range or that 80% jump to get a job. And I think that's really where we're going to head, because you're going to end up with a lot of different sites of care and that will siphon off some of the demand that's going to be created through the Affordable Care Act and through population growth and the fact that we're not growing the physician workforce. So I think that's inevitable. And again, nurse practitioners, it depends what they can do. Really, very much depends on what state they're in. If they're in a state like Texas, where very strong physician lobby, the scope of practice for nurse practitioners is fairly limited. But if you go to mountain states, by necessity, nurse practitioners can do almost everything that physicians can do, simply because we're so few and far between, literally, an hour's drive away. So I think you're going to see that more and more because we can produce them a lot faster, and the pipeline is a lot shorter.
What do you see as the good and the bad? Do you think healthcare is going to get better, or do you think it's going to get worse based on all the changes that you're seeing thus far?
Well, I think it's going to get better in the respect that if you look at accountable care organizations and, consider primary care now, where you're looking at the patient-centered medical homes and the accountable care organizations, and I assume you've talked a little bit about these organizations on your show, but essentially these are medical entities that are created to take care of the whole person and keep people healthy. And in that respect, I think there is great hope for the healthcare system in these particular kinds of organizations, because they go after the very expensive people in healthcare. Right now, 5% of the people generate 50% of the costs. And so what these organizations are doing is are throwing a lot of resources at these people who are generating all these costs and doing a pretty good job of corralling that. Secondly, they concentrate on gaps in care, which you know all about in primary care, which is people are not, they're not doing all the preventive service they need to be doing, and so practitioners are becoming much more proactive about reaching out to people, making sure they come in and do what they need to do. And then chronic disease management done correctly. I don't think it's going to so much save money, but it's going to keep people healthier. So I have great hope for those kinds of things, and a much greater emphasis on quality care. I think that's really good. I am less optimistic about costs. Right now, healthcare costs have been moderating over the past 2 or 3 years. It's still growing faster than the economy, but it's not nearly what it was before. But it's kind of like we're gaining fewer and fewer pounds every year, but we're still gaining weight. So, there's that situation. But I think another thing I'm kind of pessimistic about, and I think we all have to worry about, is the fact that high deductible plans are spreading like wildfire, and people they do self-diagnose, and research shows they forego care at equal amounts of needed and unneeded care. And I think that's going to be a big problem going forward, because we are self-diagnosing.
Steve Jacob, I want to thank you for joining us. He is the author of So Long, Marcus Welby, MD, How Today's Healthcare is Suffocating Independent Practices and How Some Change to Thrive. He draws on dozens of interviews, more than 500 published sources to cover these issues and describe how the landscape is changing. I think it'll be an excellent read, especially for those of us involved in primary care, just to get another perspective and see what he thinks about it. Thank you very much, Steve.
Thank you, Brian.
This is Dr. Brian McDonough. If you missed part of this discussion, please visit reachmd.com/primary care today to download the podcast and learn more on the series.